Hey, my name's Mary Thomas and I'm a physical therapist. One of my specialties, because I've been doing physical therapy a really long time, and one of my specialties is lymphatics and swelling. And one of the most common causes of swelling is surgery or injury. Those are two common causes. You can also have arthritis, but the truth is, swelling is the most common cause of pain, inflammation, and after surgery you can get significant inflammation. So I'm going to show you real quick. This is going to be hopefully about a 5-minute video on how to open up and get the swelling to come out of a specific area, and this one is going to be specific to the shoulder. So the first thing I want to do is find my collarbones. There they are. So right above my collarbones, there's like a little soft place. And you notice I'm coming down and in. So I'm going down inside my body and in towards the center of my body. I'm using the soft padded parts of my fingers, and sometimes, especially if you have fingernails that are very long, you might want to cross your arms and do it with the sides of your fingers. So you're not digging on this. Notice my skin is not turning red. The lighting isn't the best, but because I already tend to have kind of reddy skin. So I'm not pushing hard. I'm stretching the skin on top of the muscle. So see how that skin stretches on top of the muscle? So I'm not digging in. This is important that you don't dig in. You just want to stretch that skin on top of the muscle gently. Now, because I just had surgery, let's assume I did. I actually had surgery on the shoulder. Not recently though. So I'm going to use the backs of my fingers to come down my neck. Now notice there's a V here. I'm staying outside the V. That's important too. So I'm just stretching that skin of my neck on top of the muscles underneath. And I can feel the stretch even coming up into my ears a little bit. But it's very gentle. It feels comfortable and good. So let's say I had surgery and I can only do it with one arm. Now you can have somebody else do this on you. Just make sure that they're being gentle and going through the video, so they can use two hands. So I just use the palm of my fingers and bring it down on the one side and the back on the other side. Okay, now if you have the ability to flex your elbow, there's nothing wrong with doing this if you've had a rotator cuff repair. If you've had a labral repair, you need to check with your doctor and find out how much movement's okay. Otherwise, you might just have to do some of this, because it depends on where the tear is, how much you can move your arm and which directions you can move it in. So the reason why you want to open up your neck is lots of your lymphatic vessels and nodes are contained between this line and this line in your body. So by opening up my neck without even touching my shoulder, I've already started pulling swelling out of my shoulder. And in doing that, I'm already going to feel better, even if I'm like, no, I really can't touch my shoulder and it's not happening. So if you just work on your neck, and on my YouTube channel, I actually do have one that goes over just the neck and the face video. So you can look for that video on my channel. And it goes into more detail than I'm going to do here. Now, back here, you have this other little ridge, this little ridgy muscle back here. That's your trapezius, for those of you who know anatomy, and if you don't, it doesn't matter. Just find a little ridge. I'm stretching down, because the better I open up my neck, I'm creating a siphon, and I'm pulling fluid from my whole body, but I'm going to pull it from that swollen shoulder or swollen arm, wherever that is. So now, on my armpit, I have the front wall of my armpit, and I have a back wall of my armpit, and I have the middle of my armpit. We're going to start at the middle of my armpit, and I'm going to do a gentle press and release. Now, you do not have to hold your arm up like this. I'm doing this for the purposes of the camera and so that you can see what I'm doing. I don't almost never do it like that on myself if I'm not doing it in front of the camera. I just would do a gentle pressure. So the gentle pressure is I can feel that I'm doing a little stretch and release. I can feel I'm doing a little stretch. Now, if you're really swollen, your little stretch is going to be much lighter than what I'm doing right now on the camera and what I'm doing because, my surgeries were a long time ago. So I just do about 10 to 15, and the truth is I don't count. What I'm really doing is listening to my body, and I'm feeling that stretch, and I'm feeling how it's releasing. And even though my surgery was a long time ago, I'm actually feeling this getting softer in my armpit. And so I'm just doing a little work on that. So as I'm doing that, it's just getting softer and softer and softer. So once it's fairly soft and you're like, okay, I did enough of those. So I really do it by feel more than numbers, but if you're a numbers person, that's fine. Do 10 or 15. Then I'm going to come in behind this muscle that makes the front wall of my armpit, and I'm going to go in the direction of that center place. So I'm kind of going into the body, but up towards that center point of my armpit. Because that's going to drain fluid coming out of here. It's going to drain fluid coming out of here. It's going to drain fluid coming out of there. It's going to drain fluid coming out of here. So it's going to start to open up that armpit. And I said this is going to be 5 minutes, and we're already getting close to 7, but I think this is super important. So then I come in front of the back wall, and I do the same thing going into the center of my armpit. Now, after my armpit's nice and opened, I can work on my whole arm. And again, you notice I'm stretching the skin on top of the muscle underneath. And I'm only going in one direction, up. Not doing circles, not going up and down. It's always up, up. So if my elbow is stiff, my wrist is stiff, and this can happen after a shoulder surgery or after some type of an injury. So I can just stretch that tissue going up. And I can do it for 5 or 10 minutes, and then later today I can do it again. So as I keep that circulation moving and keep my shoulder from being inflamed, guess what? I'm going to heal faster, and I'm going to be in a lot less pain. I'm Mary Thomas, physical therapist and developer of the Body Power System.